Welcome to our June 22nd, 2022 Board of Douglas County Commissioners business meeting. I want to welcome those of you who are with us in the courthouse and those who are online. Just a couple of notes about public comment and how we run our meeting. We will have general public comment near the beginning of our meeting. That is for anything that is not on today's agenda. So if there's any member of the public here in person or online that would like to speak to the county commission about general county business, you'll have an opportunity to do that soon. And then anybody who wishes to provide public comment on specific agenda items, we ask that you please wait until we have had a presentation and discussion amongst commissioners, and then we'll open it up for public comment. All public comment is limited to 3 minutes, and we will need speakers to provide their name and Douglas County residence for the meeting minutes. The county does reserve the right to mute or remove any speaker who's rude, vulgar, or inappropriate. And we will first address folks who are here in the building with us, and then we'll move to folks online. For anybody who's watching online that wishes to make general public comment or agenda specific comment later, you'll need to use the raise your hand function on Zoom, and staff will move you over and unmute you and call on you. For any presenters that we might have online today, please plan to keep yourself muted unless you are presenting, and also introduce yourself each time for the meeting minutes when online. And with that, we will go ahead and get started with our consent agenda. We just have a couple of items. Does either commissioner wish to remove anything for discussion? Okay, seeing none, I'll ask if anybody in the public would like to remove anything from the consent agenda. Seeing none in person, none online, we'll bring this back for motion.
This is Commissioner Portillo. I move to approve consent agenda items 1.1 and 1.2.
Second.
All those in favor?
Aye.
Aye. Great, thank you. And with that, we'll go ahead and move right into general public comment. We did not have a sign-in sheet prepared today, but I see a few folks here that I'll call on and then open it up for anybody else. Justin, would you like to start?
My name is Dr. Justin Spees, and I'm running as a Republican for Douglas County District 1 Commissioner, and the seat is currently held by Democrat Patrick Kelly here. I'm known around here for starting a protest in July 2021 against the school mask mandates. I did this because I believe then and still believe today that masking children is child abuse and will have serious negative consequences, and therefore it needed to be stopped. No one listened. My message is simple. I will expose and oppose these sorry excuses for leaders. If they vote yes, I'll vote no. If they vote no, I'll vote yes. If it's something that everyone clearly sees will benefit the community and they want $5,000 for it, I'll want $2,500 for it. It's that simple. They are that incompetent and also severely lacking in morals, and therefore cannot be trusted. Current District 1 Commissioner Patrick Kelly here is a USD 497 school district administrator, and he makes $122,813 a year, which is an increase from his 2020 salary of $109,938. The school district continues to be in a massive budget crisis right now that has led to an increase in teacher and staff resignations. In fact, LJ World ran an article on the 19th on the 141 teachers and other certified staff who have resigned from the USD 497 school district, which is an increase by more than 2.5 times since the 2019-2022 school year. Additionally, in order to cut costs, the school district plans for a third of elementary classes to be multi-grade next year. What do you all out there think about that? Do you think that understaffed and overcrowded classrooms are going to turn out well or not well for the education and development of our students, your kids? But keep cashing them checks, Patrick. Keep cashing them checks. Another Douglas County Commissioner, Democrat Dr. Shannon Portillo here recently announced she's leaving her elected seat on a commission less than 18 months into her 4-year term for a more prestigious job in academia. I look at her resignation as the third scalp to collect since I started my child mask mandate protest last July. First, Douglas County Health Department Director, Dr. Thomas Marshallino, couldn't handle the pressure I put on him, so he resigned. Then USD 497 Superintendent Dr. Anthony Lewis couldn't handle the pressure I put on him, so he applied for a new job in his hometown in Alabama, but didn't get the job. But now we all know that he don't want to be here anymore and would leave if he could. And now Commissioner Portillo resigned for selfish reasons, having to do with money and greed, but also because she couldn't handle the pressure I put on her. I got 3 of you in less than a year, and I'm coming for all the rest of you if you abuse children, if you violated my rights in general and my parental rights in particular. Don't forget to vote yes on August 2nd to keep baby murder illegal because, well, it's baby murder and that makes it wrong. Don't get any simpler than that. And if you support baby murder, then they can get you to support anything. I mean, think about it. Is there anything worse than baby murder? Anything worse than killing a little baby? If you lack the basic morals that tell you killing a baby is wrong, then you will have no morals at all and will do anything if the price is right for you. Why would anyone support killing a baby? It's pure evil. And so if you'll support that, there's nothing you won't support. This dehumanization of life has led to a genocide of hundreds of millions of babies being killed. If you will dehumanize a baby by claiming it's not even a human and support killing it, then imagine what they can get you to think and do to anyone. Imagine what they can get you to think and do to people you already don't like, such as your political opponents or people you disagree with. And the evil
Time is
powers
up.
that be know this about all
Justin,
you baby
your time.
murderers out there.
Sue, would you like to go next?
Hi. The last two meetings here, the Fogan effect was brought to your attention. Again, it's spelled Fogan, is spelled F-O-E-G-E-N, if your memories need refreshed. But tonight is about the clinics scheduled in Douglas County to vax infants from 6 months up to 5 years. And I called the health department today. They're, if you have a child, they'll vax them. It doesn't matter the age. They will begin at the health department this Saturday morning. They will run various locations in Douglas County until July 12th. And just because the 3-letter agencies that we used to revere direct this across the country, it's no indication of its safety. Just as a sidebar to that, I don't know how many of you realize that during this last vaccination push, if women got that vaccine while they were pregnant, 83% of those pregnancies were lost. And I don't know if you know this either, but this is huge. Dr. Robert Malone invented the mRNA therapy used in these so-called vaccines. You know what he says about this rollout? This is a quote. He says, "Resist and fight to protect your children." He calls this the most radical experiment in human history. Adequate testing, which takes at least 5 years, has not been done. And he said the risk-benefit factor to children is nil. It's not even close. The other thing that he emphasizes is this is irreversible. You put this in your children, that's it. There's no getting it out. And their children are injected with something, he says, that cannot be reversed, that causes their bodies to produce toxic spike proteins that damage every organ and system in their bodies. Choosing to do this to yourself is one thing. Doing this to Voice's children, especially when there's no risk to them from COVID, is insanity. I'm going to be there outside the health department where they're holding this on Saturday morning. I'm going to be there protesting this insanity and this evil at 9 o'clock when the clinic opens. I'll be at the corner of 3rd and Main, so I think that'll be the closest proximity, highest visibility. Join me there, please. Anyone else who can see the ridiculousness, horror of this. Because if you don't help, if not you, then who? Thank you.
Joe?
My name is Joe Herrick, and I'd like to start with a quotation from Thomas Jefferson. "There is no justification for taking away individuals' freedom in the guise of public safety." End quote. As citizens, rather than subjects, the government is to serve us, not the other way around. Amendments 5 and 14 of the U.S. Constitution states, "No person shall be deprived of life, liberty, or property without due process." Merriam-Webster's dictionary defines liberty as a state or condition of a people who are to act or speak freely and a power to choose and do what they want to. It is a state of exemption from control of others. Liberty, in other words, is the freedom to say no. Individual liberties may not be overridden by government dictates without due process present. The Constitution does not begin with "we the lawyers," "we the judges," or "we the politicians." The ionic words are "we the people." So therefore, the ultimate jurisdiction belongs to those who voted you into office. Mandates are connected to no legislative process. U.S. Constitution, Article 1, Section 1. All legislative powers granted shall be vested in Congress of the United States, which shall consist of a Senate and House of Representatives. Legislative powers is the power to make law, modify law, and repeal law. This power belongs to the legislative departments of government, and those powers are vested in those bodies. Vested means those powers are irrevocable and cannot be given away or transferred for any reason. Therefore, mandates have no power of law because it is illegal for the legislature to give the governor or a health agency the power to legislate. Since mandates are not law, and since they violate the rule of law, not abiding by mandates is not a violation of the law, nor a violation of the Constitution. Adhering to unlawful mandates may place you at risk for being prosecuted for enforcing illegal mandates. Finally, the 14th Amendment Equal Protection Clause calls for Americans to be treated equally. Therefore, this is a general question for everybody. Why were the masked and unmasked and vaccinated and unvaccinated treated differently? Are we experiencing a new form of discrimination? Think critically, recognize why you sit there and who the true voice of America is. We the people. Thank you.
Is there anybody else here in the building that would like to provide general public comment? Okay, seeing no hands, we'll double check online. All right, we'll go ahead and close general public comment and move on to our regular agenda. I'm gonna request of my fellow commissioners that we flip-flop as we discussed during our work session, the two agenda items, and go ahead and continue our conversation about ARPA requests with a few community partners that we have.
Thank you, commissioners. At our 4 o'clock work session, we talked about hearing from a Compass project and the CCC related to some questions that you commissioners might have for them related to their ARPA projects. Do you have a preference on who wants to go first?
Kim, how about you come on up? I think we definitely have some questions about your proposal, and I guess we spoke about some of them, or we said we had a few comments during our work session. So just check with you if you have any initial responses to some of the things we discussed, or I'll just ask if other commissioners want to jump into specific asks. I appreciate the response that you gave in writing. That was really helpful. And your original request really showed us the itemized kind of budget proposal, which I really appreciated.
I would love to start with just your reaction to our earlier conversation, if that's okay with your fellow commissioners.
Absolutely. Kim Polson, the Executive Director of Community Children's Center, submitting the proposal related to an early childhood community center for Douglas County. The initial response was not unexpected. It was a significant request related to bolstering the early childhood systems in our community. We also wanted to make sure that we firmly believe that this should be a shared community investment and shared community benefit, and that Douglas County in the form of ARPA funds should not be the only investor in bolstering this system and filling the system gaps that exist in early childhood right now. But we do envision that as the first space, because of the timing and the unique nature of this, as the first opportunity for us to begin to make some great strides in that process. So I appreciated the opportunity to respond with partial funding scenarios related to 2 different locations that were in the original proposal. So again, our priority is making sure that we have a space in which we can implement the full model that our community and collaborative group has established for an early childhood community center.
So Kim,
Yeah.
for anybody else listening, can you go over your priority? I think you said your number one priority was acquisition of the building on Main. Is that correct?
Correct.
And can you give us sort of a little more discussion on why that's your number one priority?
Absolutely.
Yeah.
Yeah, so the initial request, we had talked about 2 possible locations being involved with the effort. One of those being renovations within the Kennedy Early Childhood Center, as well as a second location where we would acquire a building with ARPA funds that would allow us to establish a full model, which would include a family resource center, childcare spaces, as well as a provider academy, and have open and welcoming community spaces. The priority for us is acquisition of that building, a building for that purpose, is because we're able to implement the full model, which we anticipate is going to have the greatest impact for the community. We are able to, within that space, not only implement each piece of that model, but we also have collaborative partners in that corridor, being close in the medical realm in terms of being able to serve in that area. So definitely part of that also is a sustainable model piece, in that the building that we're talking about acquiring has other tenants that are leasing spaces that are all collaborative partners of ours, are serving early childhood with families and children. So we anticipate that it's a good space for us to be in. It creates a cornerstone of a sustainable model for an early childhood community center. And it allows us to have also room to expand in the piece of that building that we would be utilizing initially. There's still a significant footprint within that building that is other tenants, if they were to choose not to renew leases or were choosing to move out of that building, that we would have opportunities for expansion in creating new and additional spaces and partnerships. One of the things that we are doing is, in every way, shape, and form, we're collaborating rather than duplicating. So we are working with our organizations and our community to establish those relationships. And there are some unique relationships that could take place in that building that couldn't happen in the other buildings.
And this is Commissioner Portillo, just to clarify though, the goal would be to have this building on Main Street. You would also still maintain or still have the Kennedy building for other.
The intent is that we would still have a collaborative relationship with Kennedy Early Childhood and the Lawrence Public School System. Some ways in which we would see that taking place would be specifically related to the Provider Academy piece, where we would be recruiting, educating, and supporting new early childhood professionals, and be working with the Kennedy Early Childhood programs to give them exposure and opportunities for observation, insight, in another location in which to have educational programs take place, as well as community programming, where we plan to offer a wide range of community programs that could be offered at both locations in meeting that need. And within the requests, we did ask for renovations for classrooms to be created into childcare spaces. That would still be a possibility within that building. But again, we are not able to implement the full model in a district-owned building for many reasons. Some pieces work really well in that environment. Childcare works well because of the nature of one entrance, one secured entrance, signing in, signing out. The Provider Academy piece could also work in that situation. But one of the important things is the community aspect of the community center. And that is something that is forward-facing, open, and welcoming, and gaining trust of those most vulnerable in our population by having access to those resources and services. The unique aspect of the building on Main Street is that it allows us to have one entrance on the south end for childcare purposes and a completely separate entrance on the north end for community facing. So it allows us to have both of those under one roof, but being able to serve both purposes.
Can you talk a little bit about your confidence if we awarded Community Children's Center a reduced amount than what you requested. You're, you know, to my knowledge, this isn't a partner we've worked with from Douglas, with Douglas County has worked with before. Is that correct? Okay. Can you give us a little bit of your confidence in being able to acquire the funds to do the rest of the project?
Absolutely. Right now, we're benefiting from the fact that there has never been a focus on early childhood like this at all levels of government. So local, state, and federal. We do find that we have great support from the state. Right now, that's where our primary funding source includes multiple grants through the Kansas Children's Cabinet. We anticipate that that will be continuing in terms of opportunities that will become available. We can't predict what those are, but we know that there is a supportive aspect there of all of the areas that we are implementing. That is also evidenced by the fact that our first big grant was a community-based child abuse prevention grant from the Kansas Children's Cabinet for a 3-year pilot project. That's where we are right now. We're in year 1 of that pilot project. So they believe in this concept enough to know to give us 3 years to prove the concept. And to do that, we need spaces in which to make it happen. Particularly talking about the length of renovations, the timeliness of being able to make these things happen. It is going to be a lengthy process. But I definitely believe that we have the ability to also work with our private sector in Douglas County. One of our aspects of our project is not only what's happening in the Early Childhood Community Center, but is across the county. It's not about a building per se. This concept, this ask is about a building, but what we're doing is about the entire county and elevating early childhood infrastructure across the board. So it gives us the opportunity to look at the private sector as a new investor in this system. So the Chamber of Commerce and Community Children's Center, we have been meeting with our largest employers in the area, beginning with family-friendly workplace practices, doing a free survey that is available to give us information in Douglas County. But we are also talking with those businesses about, once we have those data points, how do they collaborate to create an investment in early childhood that supports their employees? And so we envision the opportunity for businesses to invest in that and have childcare spaces available as a benefit to their staff as well.
This is Commissioner Reed. Kim, it sounds like, I mean, this vision, which I can see and I think is a significant need. Can you give us a sense of how much that expands on the current work of the ECCC and kind of what the scope of reach, I guess, that you all have in programs? Like, part of my question is in terms of the additional capacity, staff capacity, and then support for that ongoing staff capacity that would be needed with all of these additional elements.
Absolutely. Right now, we are a small staff. Community Children's Center actually used to administrate the Head Start program at Plymouth Congregational Church until a change in the federal structure eliminated that level of the administrative arm. So we repurposed ourselves as an organization with the intent of serving early childhood communities from both ends, both the professional end, the provider end, as well as from the family aspect. And so in doing so, we want to identify gaps and fill those gaps in the systems, because we have some nimble nature that maybe the Head Start program doesn't have because of regulations, or other organizations don't have that capacity because they are in the moment taking care of children every day. So our goal is to make sure that we are collaborating. So in terms of staffing, when we look at the core implementation team, there's 2 full-time people and 2 part-time people who are doing this core work. I think we have made significant strides in that. We know that that is not enough to implement a whole model. So we need to make sure we're creating an opportunity for collaborative partnerships. So we're working with organizations who already have staffing in place for our collaborative relationships that we have in mind with Just Food, LMH Health, making sure that we are utilizing our partners rather than hiring all of that infrastructure under our organization. Where we do see that infrastructure needing to take place is related to our childcare concepts And we envision we're building a model of, we know providers can't make less and we know parents can't pay more. So we know there's a funding gap there. And our goal is to create the highest quality spaces, not just slots, but it's got to be quality spaces for children to be cared for and learn. So we're working with the Provider Academy to grow our own providers. So we then have the ability to hire them into that because we will have a model in which we have private sector investment happening in terms of supporting that on a sliding scale. So families have the ability to have access to high quality care regardless of their income status. So we're wanting to make sure that we don't look like we will ever be a large organization in terms of employment, but we will be a large collaborative partner in terms of the reach and what we're able to do for the county.
So speaking of some of those collaborations, you mentioned a few of them. And I know we have somebody here from the Compass Project, and they had mentioned the ECCCs, the center in their proposal. And can you help me understand kind of what the status or historical collaboration or conversations about future collaborations has been like with Compass Project?
Absolutely. One of our goals with the Early Childhood Community Center is to help connect the dots for families. We know that's one of the biggest challenges is that it's too difficult to work through so many systems to gain access to the supports that they are eligible for and need to have access to. So that's our goal, is to connect those dots through our work, both online with the Tykes Online Resource Hub, which just went live last week, as well as through the Early Childhood Community Center. So in connecting those dots, we feel it's extremely important to have people in place to make those personal connections with families, and that is through navigation support. So our goal is to make sure that we have a navigator, multiple navigators eventually within our structure. So when families are dropping off their child, they have the ability to say, okay, wait, I need to ask about this, or the provider helps to identify, you might need access to rent and utility assistance or SNAP benefits or TANF. So being able to have one of those navigators in that space can meet families where they are on a timeline that works for them and provide that support there to connect them with their other organizations and work through the process, work them through the paperwork process. So a Compass Project, again, we want to collaborate. A Compass Project has already been doing this very well and has navigators in place both at the health department and Heartland. And so we're looking at this as a possible other point of access for that. We anticipate we're going to need community navigators no matter what. We want to partner with an organization that's already doing it well. So that is the kind of the collaborative conversation of where can we meet families where they are so we can get them to the supports they need.
Thank you, that helps. Do you envision that it would be a part of the center and based in the center, regardless of whether or not they're a ECC staff member, or that they would be leasing some of that space from you? That you mentioned that corridor of other spaces that are currently filled with some community partners and potentially future ones.
I would anticipate that would be something that we would work through specifically with a Compass Project, determining what that space need is. Typically within that building, there are office spaces that we will have access to because we anticipate community partners will be coming into our space to meet families. For example, if there is a child who needs a specific type of therapy, maybe speech therapy, we envision having spaces in which other parts of our community and collaborative partners can come in and serve families and children where they are. So we envision that type of relationship by having a community navigator in hand as well. But I would also defer to a Compass Project with how they wanted to manage that relationship based on what they have established with the health department in Burt Nash.
Sure.
And Heartland.
Sure. Okay, thanks, Kim. Other questions?
You mentioned there was a Compass Project at Douglas County Public Health, which is right down the street from this building, correct? I'm interested in sort of what your research has been on, like where these things are spread out in the community, not only from that navigation process, but also the choice to put it, you mentioned the access to partners along that corridor, but is this a hot spotted need for early childhood in this space? Why this space? Why that neighborhood?
It's definitely one of the areas that is in higher need in terms of home-based providers and centers. What I've been doing is I've been going through trying to target specific neighborhoods and areas where we can see the number of children who are under the age of 5 and the number of licensed providers that are also located in that zip code, and trying to determine how do we increase that not only across Douglas County, but in areas that specifically are in need of it by either locating ourselves there, identifying partners there, and outreaching to that area and neighborhood to try and support in terms of access or maybe interest in home-based providers beginning of those areas. So it is an area of need. We also know that the area in which the Kennedy Early Childhood Center is also an area of need when it comes to this. We find that most of our spaces that are east of Iowa are at least in some area of need when it comes to access to either a center, a licensed center, and a licensed home provider. So we do feel like this is a valuable area that we need to be in. It's not the only one. It would be the first one, and we would see how we could utilize our services to prove the concept and then outreach to other specific areas on a smaller scale to make sure families have what they need where they live. We also envision it as also being a high population area in terms of employees. So not only the people who live there, but we're also talking about a significant number of staff that are working within that corridor, even if you just look at LMH alone. So being able to serve not only those who live in the neighborhood, but also those who work.
Okay, if there are no further questions for Kim, thank you for sticking with us.
Oh,
We
absolutely.
appreciate
Thank you.
it. Devin, if you don't mind coming up, I just had a quick question or two for you. So I'll just start by saying thank you so much for your response to some of the questions that were asked, and just trying to kind of understand where you've been and where you are and where you're trying to go, which I appreciate your answers. That helped me some. As a local service provider, I am very well aware of how heavily utilized and well-liked your program is. So I appreciate how accessible you are and hear consistently great feedback about what a massive help it was to get through those Medicaid applications and then to subsequently get help with things like DCF benefit applications, disability processes. Those are things that many people don't do because the inaccessibility of those forms and how difficult they are to understand. So I just want to say that I'm really supportive of a Compass project and want to see you continue in this community. The struggle I'm having with your request for ARPA is that it is ongoing dollars, and fundamentally that is something that this commission was pretty clear in the beginning of not being as supportive of, because we don't want dollars to make a 2-year impact and then that impact dissipates. So I guess I'd just like to give you the opportunity or hear from you what you realistically, kind of what the trajectory you think is of the Compass project without ARPA dollars. And also if you can help us understand a little bit more. I see in your answers that you mentioned that Heartland Community Clinic has been contracting for a minimum of 25 Medicaid approvals a month. So that seems like that's a portion of some of the work that you're doing, but it's probably not meeting all of the need in the community. Or I guess help me understand that a little bit more. And if also clarify, are the Navigators dispersed amongst different sites? And what kind of do you see in the future for that?
Right. Okay, well, thank you for your complimentary words about the work that we do. Commissioner Reed, my name is Devin Kim. I am the executive director of a Compass project. I'm also the CEO of Hassie and Long, and that's where Compass came out of. because of the work that we do at Hassie and Long, which is contracting with hospitals to help them get paid for serving their uninsured and underinsured patients. We had folks coming to us in the community because we don't serve at the hospital in this community. We had folks coming to us directly and asking us for help. And the way that we get paid is when the hospital gets paid, we get paid a portion of what the hospital is paid. So when you're helping someone with an application and there is no payment source that you are contracted to receive a portion of, that's essentially a free service. But during a week in 2018, we had multiple asks, including a close personal friend and the Douglas County Dental Clinic asking us to help with kids in schools. And that's when I realized that there was a real need in Douglas County. And we just baby stepped a nonprofit by essentially Hassie and Long incubating a nonprofit, giving them the office space, giving them all of the software, and giving them the employees to be able to do the work that Compass was doing. And we donated that at Heartland until we couldn't continue to do it. And that's when Heartland decided to contract with us for a minimum of 25 approvals a month. So essentially that funds someone being at Heartland for 2 hours a day, 5 days a week. That allows that navigator to be able to actually have a face-to-face conversation with someone, maybe do a full screening, maybe just do a partial screening, but start to actually gain the trust and understand the situation that that person is in. But most of the time, the actual paperwork, all of that stuff you were talking about happens back at the office. So we'll be on the phone and getting the verifications that are needed to be able to submit that paperwork to the state. So, so we do have someone at Heartland 2 hours a day, 5 days a week per contract with Heartland. We work a priority list from Heartland that is that are uninsured patients that are actively seeking care more than once a month. So that's how we build our referral list. We're not able to get through it. Usually there's over 100 people left every month that we're not able to get to. And so we just keep plugging along. So when Douglas County Public Health had funds available through a COVID grant, they were able to create 2 additional navigators to continue doing that service. So we were able to expand the work that we were doing at Heartland. Most of our referrals continue to be on that list of folks seeking care at Heartland, but disease investigators at Douglas County Public Health would forward us referrals as they came across folks who needed assistance. We are not embedded at the health department. We do not have a location there. And that grant is coming to an end. We're coming to the end on that in November. And we were able to get some additional CDC dollars to kind of build out that program a little bit more. And by that, I mean, putting 0.25 of an FTE on, so they were able to make more calls and follow up with more people. So as far as longevity and what the trajectory is, at this point, COVID funding will continue to peter out, and we will go down to 1 FTE, 2 hours, spending 2 hours a day at Heartland, and that minimum of 25 approvals a month. What I believe the landscape has in store for the work that we're doing is actually the alternative payment models that CMS is running all across the country right now include the ability to carve out services that are provided. We talk about this with social determinants of health in a variety of different ways. But the work that we do with patients will actually be carved out in payments. It's already being done in states like North Carolina and Massachusetts. So I believe that will come to Kansas, obviously slower than those other states, But I believe at the end of 24, we will be able to find funding for the work that we're doing in alternative payment models. So I see the ARPA funding, I know it's a stretch, but I see it as a bridge for work that's already being done and a bridge to get us to where we would actually be a sustainable resource in this community that's actually funded through alternative payment models. So hospital and physician bills.
Thank you. That
Yeah.
helped a lot. I appreciate the context and the history. I'll be honest and tell you that until very recently, I thought that you were a program of Heartland because that's how many people access it. And it sounds like that remains true. And so it's helpful for me to understand the origins of that. Any questions from other commissioners?
This is Commissioner Portillo. I think my biggest question was around that sustainability aspect. And I do really appreciate and hear what you're saying. This may be a bridge as we see new models appear. And that does make me feel a bit better about how we're using some of this funding over the next 2 years. So thank you for that.
Thank you.
Okay, well, thanks so much for staying with us. We appreciate your time.
You bet. Thanks.
Would you like to have any further discussion amongst commissioners based on that, or do we want to let it be until next week?
Well, I think next week, our conversation is mostly going to go back to housing and how we balance the remainder of ARPA funds with the behavioral health tax. So I would be in favor, if my fellow commissioners feel like we're at a point where we can have the discussion, I would be in favor of us kind of trying to figure out amounts that we would feel comfortable with for CCC and Compass, so that we go into next week with a firmer understanding of how much we have left in ARPA and how we're balancing between ARPA and behavioral health tax.
Yeah, that makes sense.
Yes, Brooke, if you could share your screen, that would be really great. Thank you.
Thanks for catching that. So I would just say I think that the plan for the 346 Main Street is a compelling one. I really love the holistic approach and that it is both for providers and families. As was noted, the kind of differentiation of the two parts of the project, if we were to only partially fund it, most of it, still 5.6 million, is the total for that 346 Main Street project. So it really doesn't bring down the total number a whole lot, relatively speaking. In terms of parsing out the amounts differently within that, I'm open to ideas and suggestions.
I would be in favor of just funding the whole Main Street portion of the project, because I agree, it's a holistic approach. It's something that we desperately need in our community. And I think it does check a number of those boxes of centering some of the most vulnerable in our community, focusing on this is an economic development project, but also making sure that we're connecting families to resources. And it is that holistic kind of resource approach that I really appreciate about the place-based nature of the Main Street project. So I agree, it doesn't really knock down the price all that much if we just focus on that and take out the Kennedy kind of remodel piece. But I think that's where we have the biggest impact, and it gives a really great launching pad for ECCC to see if we can prove this concept and move forward as a community.
I love this project. I think it's been a long time coming that we need to address early childhood education. And I especially appreciate this partner's request for high quality and the fact that we're educating and building our capacity for early childhood across the community. So love this. It is also unique. This is not a space where the county has participated before, and that's not saying we shouldn't. I'm just saying it's new for us. I'm, if we've got the dollars, 5.6 million sounds great. I'm a little bit concerned as we move down the road and we look at the total numbers, whether we'll be able to do everything that we want to do. And so I would just share, you know, when Kim shared with us today and how she would scale that budget, it seemed like acquiring the building was the number one thing that she needed. And I want to make sure we do that at a minimum. But I'm also as I keep adding up the numbers, I put that out there. Like, I think we can make a huge dent and send a real message that this is something that, you know, this commission and future commissions probably should be interested in, as from an economic development, from a community health standpoint, from addressing systemic racism. I mean, there's a lot of reasons for good quality, high quality early childhood education, but this is a new space for us, and what's our capacity to sustain it long term.
I hear you, Commissioner Kelly, and I wonder if what we could maybe do is put in the acquisition amount as a for sure amount that we want to fund, and then include the balance of that in the, let's see where we're at after next week's discussions. Would that be something that my fellow commissioners would be cool with?
Yeah, I think that's a fair proposition and makes some further progress for us and gives us a bit of flexibility.
So Brooke, I think right now we're just agreeing to the 2.5 million. That's the acquisition of the building.
3.25 million.
Thank you. With, maybe we need to put in the comments that we are in favor, if funds allow, of funding the rest of the Main Street project.
Any further comments or questions about this one in particular? Well, I'm interested to hear fellow commissioners' thoughts about the Compass project. And initially in the staff ratings, it landed in the medium list, which was easily a majority of the projects in total. In this one, and I primarily because of the ongoing expenses. So I think that, as we've discussed a little bit here, that is of concern, but of all the projects with ongoing expenses, this is one that I guess I still feel attached to, and I'm wondering if there is a way to help sustain this program and be a bit of a bridge, because I do think that it's pretty high impact in my personal experience, and don't want to see the community lose it, but want to be smart with these dollars.
I fundamentally hate that this project has to exist, because I think that this is purely about the administrative burden that we put on accessing community resources. So I appreciate that the Compass project exists, and I hate that it has to. I did find the discussion of switching to alternative payment forms and really focusing on those social determinants of health resources that we know are coming because they've been a part of ongoing conversations. I do see this one as falling much more into that bridge rather than ongoing expense category, but it is still a bit fuzzy in a way that some other projects aren't as fuzzy. It is, I hear what you're saying, Commissioner Reed, this is one that it hits those high value buttons for us as a community. And so I do think it's one where if we really believe that this is a bridge that a couple of years of funding can support as we move on to new models of social determinants of health funding, I could get behind supporting it.
So this could be like a lot of programs on our list. It's great. I want it. I'm sorry that we have to have it. I agree with all that. I have, whether it's a bridge or not, that is tough for me, because there's some other applications that we had that have similar sort of positioning, and that we would start this, we would pilot it, we'd do something in the beginning. Community Navigators, we've had a lot of requests for those. You might remember in our last budget cycle, we had a request from United Way for a community navigator. So this is a need out in the community in a lot of different ways. As much as I love this project, sort of, if I have to draw a line, it's about sustainability for me. And that's really hard because there's a lot of great things out there, but I have concerns about providing this for a number of years and then getting to the next year and the next year. There's some other applications that I really like that didn't make my cut because I can't see how we sustain them long term.
And I'm okay saying we cannot fund this because we have enough one-time expenses to fund. That is okay with me as well. If we are at that point where you're right, there are other projects where they could make the same bridge argument. They're just not quite in that like public health bullseye of the target of what we as a community are saying we want. And there are still plenty of things that are one-time expenses that we can fund out of this list. So I am swayable is what I am saying.
I appreciate both my fellow commissioners' points and yeah, I think that given the totality of the projects we have before us, that because there are plenty of one-time expenses, that the funds will be easily exhausted. So I think, but I appreciate you all giving space to have a bit more further conversation about it. And I would not necessarily in the coming weeks, because we've got some very busy weeks ahead of us, but maybe plan for a larger conversation around the various community resource navigators and how that's defined differently, specialized navigation that I think the Compass Project does with Medicaid applications and whatnot, that is maybe not the definition of some other community resource navigation. So I'd be interested to have more conversation around that and specifically talk a little bit more about the different web-based and app uses for that. So we talk a lot about My Resource Connection, but then there are the Compass Project proposal, and I've recently heard about it more in the community too, a little bit, the Unite Us application for navigation. So anyway, a bit more study about that I think would be helpful in the future. So, okay. Any further thoughts or questions about this item? All right.
Brooke, do you feel like you have what you need from us for today?
Thanks for checking, Commissioner Portillo. Okay, well, thank you for staying with us this evening. We appreciate your extra time. And with that, we'll go ahead and move to our other regular agenda item, which is an update from Lawrence Douglas County Fire and Medical.
Thanks, commissioners. I'm going to introduce Interim Chief Tom Fagan, who's here to talk to us about the strategic plan and just other questions as we approach it. So Chief, I'll turn it over to you.
Chief, I'm so sorry. I'm going to disrupt one more time. This is Commissioner Reed. It occurs to me that I didn't open up public comment on that last agenda item.
Yeah. Well,
Should I rewind and do that?
sure.
Process
It
wise?
appears that people didn't I don't see anyone.
If there's anybody online, if you can just
I don't see
verify
anyone
that.
online for public comment
Okay.
on our ARPA funding
Make a note of
continued
that.
discussion.
Okay, thank you for verifying. Appreciate it. Sorry about the disruption and I appreciate your flexibility. I'll turn it over to you.
Great, thank you so much. Well, first of all, it's a pleasure. Yes, thank you. Well, first of all, it's a pleasure. My name is Tom Fagan. I'm the interim fire chief with Lawrence Douglas County Fire and Medical. Tonight with me is Mackenzie Azell. She is our fire medical analyst and our new accreditation manager at Lawrence Douglas County Fire Medical. She's been in this role for about the past 6 months. And so we've got a lot of great things to share with you this evening. Some of them are requirements as a part of our accreditation process, but a lot of them are process improvements, things that are in the works, but also sharing some very specific things relative to the accreditation process, specifically what our performance is, where we are relative to targets, and where we're wanting to go in the future, and some of the challenges that we're facing you need to know about. And so those are some of the core tenets of the accreditation process, which you're going to learn a lot more about tonight. Very pleased to share with you that over the past 18 months, we've been very busy, not just operationally, but doing great things to what we believe is a process improvements for our service delivery. One example being a renewed agreement between the city and the county for EMS services. There's a lot of work by a lot of people that went into that over a long time. And so that's something that was a big success this last year. We're just wrapped up the administrative memorandum of understanding, which formalizes regular governance meetings between the city, the county, and the organization to better plan for the future of our provision across the county. So that's something we're really excited about. Mackenzie's going to be sharing with you some of our process improvements, which include collaboration with the Emergency Communications Center and also some new mobile application tools that you'll hear about Pulse Point a lot if you haven't already. So with that, I'm going to turn it over to Mackenzie, and she's got a lot of great things to share with you. So thank you so much. And we'll have time for lots of questions at the end, and looking forward to those and some great dialogue. So thank you.
Awesome, thank you. Hello, does this sound all right? Perfect. Okay, I'm Mackenzie Zell, like Chief Fagan said. And so today we have a presentation for you that's providing an update, and then we'll be able to have some time for questions. So Chief Fagan and I are here for Lawrence Douglas County Fire Medical, but we put this slide in the presentation because we want to remind you who LDCFM is. And these are some of the great faces that are a part of the department. So what we've been up to this last year or so, we did a community-driven strategic plan in late summer, early fall of last year. And this project was a complex project that had a few different inputs and then a lot of work sessions. So we had external input, which comprised of 54 external stakeholders throughout Douglas County. We had academia, we had governance, we had public safety, we had the community members a part of this group, and the SIPSI Technical Advisors Program actually hosted 4 virtual meetings. And this was through COVID. So you can see our stakeholder group was wearing masks during our internal sessions. So it was really cool that we were able to reach that much of the community and get valid input for us to take to our agency stakeholder group work sessions. We also had internal input where we opened up a survey to our entire department, and we received 92 responses of survey data. So that survey data from the internal group and then also the external group was taken to this agency stakeholder group where we did these work sessions internally with the technical advisors program. And we spent 3 days, we conducted a SWOT analysis. Everybody had the raw data from these surveys that went out. And then we reviewed it and came up with some strategic goals.
Mackenzie, this is Commissioner Portillo. Just a quick question. So on the internal, you mentioned you had over 90 surveys returned. What's the response rate for that?
So we have 150 members, a part of the department. So whatever the 92.
Thank you.
And this also included an administrative staff. So I believe, do we have 156 total? 156 total. And so this did include civilian staff as well. But it was open to the entire LDCFM group. So we created these strategic goals: internal communications, external communications, leadership and development, employee health and well-being, succession planning, and recruitment. So through the strategic planning process, we really wanted to work with the technical advisors program to show where the department was going, not only in our goals and objectives, but also how do we incorporate more than just LDCFM and those members or the people within the organization. So we wanted to create some imagery, which is shown on the right, of that collaboration, that strategic alignment between LDCFM, Douglas County, and the city of Lawrence. And so throughout that whole document, which we have provided you today, it is the hard copy. And throughout that document, it shows how we can take these organizations and move forward strategically. Also, to add to the strategic goals and alignment, we are working on our 2022 Community Risk Assessment Standards of Cover. That is going to be a document that reassesses what the services that we were able to provide, how we're doing, and then the direction of kind of where that's going. So that's where the goals will come into play. And we are also currently working as an internal communications team to focus on this first goal. And we had created a poll throughout the department to see what was going to be prioritized. And the internal communications was priority number 1. So we've already met quite a few times and are producing the first report out of that. So just kind of exciting as far as things moving along. So the continuous improvement model is what Lawrence Douglas County calls our accreditation, if you would. And so really wanting to embody what that looks like versus just doing what we need to do and checking the box, because that's really what accreditation is not about. So through this, we have a third-party validation of 250 performance indicators. These are spread out across 11 categories. Those categories can include or do include health and safety, EMS, fire suppression, domestic preparedness, IT, finance, HR, a whole bunch of different things, really getting a clear look at what your agency and those partners that support your agency are doing. So why are we here? We're here because some of our performance indicators and core competencies tell us that we need to be. So if we look at 2D, the plan for maintaining and improving response capabilities, that first one is seeks approval of its standards of cover by the authority having jurisdiction. This is that document that we will be finishing up this summer and wanting to present to you late summer, early fall. The core competency 2D9 is on at least an annual basis, the agency formally notifies the authority having jurisdiction of any gaps in current capabilities, capacity, and the level of service provided within the delivery system to mitigate the identified risks within the service area as identified in its community risk assessment standards of cover. So that is what we're doing today, and we'll dig down more into the recommendations and performance indicators later on. So what does the accreditation process look like for LDCFM? Well, we have some key roles and some training that we do throughout the entire department. I do want to make note that these key roles are not individual people. So I wear many hats. For example, accreditation manager is one of them. We have one fire admin staff right now. She is the assistant accreditation manager. And then we have program managers who are kind of a range of our chief officers and also our captains. And then we have task force teams for different projects that we work on. The internal communications team is one of those task force teams. And those teams are comprised with firefighters that we had a firefighter that had only been on the job for 3 months. And then also our fire chief being on that board. So with that, we bring in our admin civilians to be a part of that whole process and to have a say and to learn and put input into each of those groups. We also do training, and continuously we work towards recommendations that you'll see later on. We also have positive improvement to create process improvement to create positive movement towards response time benchmarks. We'll talk a little bit more about that later as well. And then reviewing and updating SOPs, the standard operating policies and procedures. So we kind of talked about our process improvement, what we're able to directly impact. So I'm going to kind of switch gears into our demand. So we're doing all of these things that are trying to help the organization grow in not only our processes, but our response. But something that we see that is impacting us is that total incident count, that the demand that we have on emergency services. So this is a total incident count graph that shows from 2006 to the projected 2022. Right now, we're using the projected based on our moving average daily of incidents. And those are all incidents. Those are non-emergency and emergency. And so with that, in the last 2 years, from 2020 to 2022, we've seen a 24% increase. So that is alarming to us, and that we are seeing that play out in our activities as far as scheduling things and having people be a part of groups. Makes things a little difficult. So in 2020, we published a station optimization analysis, which really focused on growth needs. And I do want to make a note that this was published in 2020 using 2019 data and then data prior to that as well. So these recommendations and that report solely speak to that data. So you can see the cover on the left, and then on the right is our map that shows our 3 main gap areas. So we looked at gaps and we looked at response and data from the entire county. And really we got down to where are the gaps hitting the urban density population. And these 3 gaps were identified. So just to remind you, because I think it's been a very long time since you've seen our maps with that green layer, this is our standards of cover. The standards of cover show the 4-minute drive time coverage from each station that we currently have. This is on that perfectly sunny day, there's no traffic, everybody's in their station ready to go on a call. And it only looks at that travel time. So we use GIS to map that and to see what those capabilities would be. So what have we done process improvement wise as far as collaboration to try to impact the demand and that response? Well, we've worked with the Douglas County Emergency Communications Center and then also the county first responder agencies and have worked on an enhanced dispatching process. This dispatching process can also be seen in the annual compliance report, and you guys have that as well. So we've seen some positive improvements with this dispatching process. There was a learning curve in the beginning, but we're excited to see how that county-wide change has improved different departments' response times. Also, Pulse Point went live for Douglas County last September. So that was really exciting. So we're hoping that this really makes an impact on our bystander CPR. So what we're looking at here is a map of Douglas County. We have 7 rural density zones that we look at whenever we measure our response capabilities and basically how we're doing. So this is high EMS, which would be related to our cardiac arrests throughout Douglas County. And then you can see based on the color coding what that response performance was. This is the same thing, but for the urban densities. So this is City of Lawrence, we have Eudora, and then also Baldwin. And this is for 2021 data.
Quick question, can you go back one slide? So I'm noticing the number of incidents that you have. Are there standards for the number of incidents you should have before you start to count that as a marker? You know, so in my world, you have to have 20 to 30 students before you start to say, okay, now we're seeing a pattern. 5 is a relatively small number. Is there a number that you're looking for?
I'll answer that question. Tom Fagan, interim fire chief. So there is not. And the reason is that every incident can have a very significant impact, specifically when you're talking about high risk fire, high risk EMS. So when we look at these planning zones specifically, even though that the end value of the data set is small, the outcomes can be very significant, even if it's one incident. And so we don't have a minimum end value to qualify the data set. These are all quality data points. And so the one thing I would add to this as a part of that qualification for data sets that involve first responders outside of the city of Lawrence. So for example, if there's a first responder agency that co-responded, that data is their performance data is not included in this performance threshold. So it is possible, for example, outside Baldwin City or around the city of Lawrence, if there was another first responder agency that co-responded with us, they may have arrived sooner. That data is not included in our performance metrics. This is looking at our organizational performance.
I'd also note, and this has been kind of an ongoing conversation, this 10-minute marker isn't the same accreditation type tool that 4 minutes is inside an urban density area. That has been tested. That is true. It's tied to those things. There really isn't good data for what rural response time should be. What we do know, and I think, like, if I remember correctly, so Chief Fagan will correct me on this, that 10 minutes really can tie to cardiac arrest. You know, that if you can get to somebody within the first 10 minutes, there's higher likelihood of positive outcomes, survivability. Good job.
Survivability.
I was like, what's the word? So that 10 minutes is really tied to that, but not every high risk EMS call is a cardiac arrest. So just thought I'd mention that too.
Yes, to go further, and thank you, Sarah. So our rural benchmark standard is 10-minute travel time. And then our urban standard is 4-minute travel time. There is not a quality best practice for travel time standard for rural population density. However, there is for urban density. And so that is something as we're looking towards the future, that as we're looking at service level standards in the future for the rural areas, those are conversations that we need to have if that's something that we need to adjust. So, yes.
Okay, over the next few slides, these are going to be very word heavy, and I'm not going to go through all of them specifically or read all of them to you, but you can reference them at the end if you have questions and we can go back to it. But we have recommendations. With this specific slide, we have 10 strategic recommendations, and those are tied to our core competencies through the accreditation process. This first core competency actually has 4 recommendations. And you can see the recommendations in the light blue and then the status of those to the right. So I have a few slides of this that I'm going to go through just to review. And then if we have questions, we can go back.
I apologize to interrupt.
That's okay.
Interim Fire Chief Tom Fagan, just to add for context on these recommendations, they came from the 2018 accreditation report. And so these are recommendations that we've been working on since that time. So when we talk about these recommendations, they're from our last accreditation process. We're getting ready to prepare to submit our documentations for reaccreditation this fall. And so there will be an additional new report that will be generated based on that assessment. And we should receive that next spring.
Thank you. And also the Accreditation Commission gives us these recommendations, and LDCFM accepted these in 2018. And then we have our specific recommendations. And the only difference with this is that they're not the core competencies. These are just a part of the performance indicators. So again, like I said, there was 250 performance indicators. This addresses some of those. In the overview of those, we have implemented 7. We've partially implemented 11. We have not implemented 1 as of this time. So 19 total recommendations. And that concludes our presentation. I would like to take a quick plug to say 2 steps can save a life. Call 911 right away and push hard and fast in the center of the chest if there's a cardiac arrest situation, and download the Pulse Point application. It's free for Douglas County to subscribe to our Douglas County first responders and also Lawrence Douglas County Fire Medical. Thank you.
Thank you both. Really appreciate the presentation, and again, your flexibility and sticking with us a little later and going second tonight. So I'm just curious in looking at these maps, and I mean, the numbers of the response times in the map zones is helpful for me. So I'm just wondering if you can give us a little bit of historical context or information around whether or not there's ever been discussion about a station in North Lawrence and or any specific barriers that might exist with LDCFM serving North Lawrence. I just think of, I mean, as somebody who grew up here, it's sort of amongst townies, like it's big talk and conversation sometimes that there is no station over there, and that if something were to ever happen to the bridge, that point of access from fire and ambulance is cut off. So I just wanted to take the opportunity I can see that in terms of incident calls, like I understand why the recommendation for the Northwest Lawrence in terms of population density and growth, it seems like has a big impact. But just wondering if you can speak a little bit to some of the current conversations or concerns around North Lawrence.
And maybe
Yes,
Mackenzie, you could stop sharing your screen. Thanks while you go ahead.
Yes, thank you, Tom Fagan, Interim Fire Chief. So North Lawrence, we do pay very close attention always in regards to our resource availability, reliability. It's one of the reasons we have multiple planning zones that we're watching to ensure that we're looking at performance not across the entire system, but in specific geographical areas. And so when we study those geographical areas, we look at what our capabilities are from each one of those stations and the station optimization analysis, which is very detailed. I understand that. That was a part of that study on what are our capabilities to get to all geographical areas of the urban density locations, specifically in this case in Lawrence. And what we found is that area from Fire Medical Station number 1 is actually capable of receiving very high quality response performance when they're available, similar to other areas of the city of Lawrence. We did find, however, that there in those gap areas that are circled with the red ovals, those geographical gap areas within the city are not capable of receiving the 4-minute response time service from the existing standards of cover. I'll come back to North Lawrence very specifically. I've had some conversations with a few of the residents in North Lawrence, specifically here recently with several of the planned events in downtown, where there was concern in regards to potential impacts to the bridge for accessibility of emergency resources. We did have a few emergency calls during the National Championship festivities that were occurring. We had planned in those instances at that time. And so when we have a known impact to where there is a controlled measure on the bridge specifically, we will position a resource in North Lawrence to ensure that we do have access to those areas. And that's when it's a planned event. And so our shift commanders are watching our standards of cover all the time. And so if we have to call upon our partners in the county or even outside the county to assist us from time to time, we will. But that is a challenge that we're constantly chasing on service quality. One of the slides that is in the station optimization analysis is called, the incident call impact. And so what that is showing is that all the time, that green blanket of our capabilities is constantly evolving. Right now, our moving daily average is around 44 to 45 calls per day. And some of those calls necessitate more than one vehicle to respond. And so anytime there's a call, a segment of that green shade goes away. And it's constantly moving, and holes in this blanket of the standards of cover are coming up all the time. And so that's something that we're always watching. But unfortunately, as our call volume is increasing, that blanket has more holes in it more often. And that's causing delayed responses to many geographical areas within urban areas of our community. So much so that we're no longer meeting any targets for our response times in our urban planning zones anywhere. And so as we look towards the future, we're going to need to address these service gaps to maintain our service levels.
I had a question, commissioners, that might piggyback pretty well on that if I could jump in. And I think, Tom, like if I go back to the slide that Mackenzie had where we talk about the total number of incidents and the 24% increase in the last couple of years, and then I look at this is going to be a 2-part question. So those numbers with these EMS maps, walk us, would it be possible to get that graph data broken down by EMS incident, so that we could have a better sense of like what specifically is driving, where are you seeing that increase? And I know from our conversations, it is really related to EMS, but I think that would be a good data point as you're thinking about budget to like bring us some of those pieces. Related to the 24% increase, I'm concerned, like I've been telling folks that it's not a good idea to make decisions based off of what's happened in a pandemic. Have you spent some time thinking about, or do we have any reasons why we think this has been such a dramatic increase over the last 2 years besides just a global pandemic? Or I guess I was hoping you could just speak to that.
Yeah. Yes. So the 24% increase, and we have dug into what are the call distributions that's maybe driving that? Is a certain call type or a certain group of call types? And so we actually did a comparison analysis in the last 24 months. What does that distribution look like comparatively prior to 2020? And it's relatively the same. It's an increase in calls that is proportionately the same.
In almost every category?
In nearly almost every category, yes. And like we've shared in the past, the bulk of it is EMS calls. But all calls overarchingly are increasing. So, and we will have that data available to share with you on the 5th, if you know, that's something that you would like.
I just think that detailed breakdown on the type of call is particularly when we're showing, you know, EMS versus high risk, to get back to that, you know, because it gets a little bit to Commissioner Kelly's point, you know, even 43 incident, like what's your time frame for the MAP call? What was the time frame for those 43 incidents? Was it all of 2021 or is it, you know, I just think some of that detail would be helpful.
We do have a policy for inclusion for qualified data set. So all of that performance is only emergency response incidents. So we have, as you saw, approximately 15,000 calls. Not all of them are emergency incidents. And so when we look at our response performance, it's very specific to emergency calls to make sure we get a pure data set on our response performance actuals.
Commissioner Kelly, I appreciate the work you do with emergency communications and working together with all those first responders. That was something we had talked about previously, like we thought there was an opportunity there, and it's neat to see that manifest itself. As we think about how we can continue to work together and collaborate, we fairly recently, created Fire District number 1, and you mentioned that some of the response calls that you're looking at were probably responded to by our rural fire department sooner than what's indicated on there. Because of the wide area that district covers, is there any opportunity to work with them to gather data for those unincorporated areas a little differently?
I think it's a possibility. There are some challenges there relative to quality control processes, but it's just we don't know yet. But I do think there is an opportunity for further collaboration with our partners in Douglas County. You know, enriching our data just makes it that much better to make, you know, informed decisions. You know, we look at data, we have an inherent understanding of what we believe to be the case. And when we see data, you know, it's like shining that flashlight to show and say, is it what we thought it was? And sometimes it isn't, and a lot of times it is. You know, oftentimes, you know, when I transitioned out of operations into administration, and what you realize when you're doing work like this is that most of the folks that are out running the calls, they inherently know where the gaps are. They know where the challenges are because they see the outcomes. They know when they get that cardiac arrest call in that gap area that the chances of the positive outcome are not as likely to be good. And so one of the things that is, I think, a great value to our community is that we are able to provide a very strong data set, particularly in urban areas. But I think it is an opportunity to get better all the time. And we'll continue to work with our partners. I know that at the county chiefs level, we've talked about that opportunity in the past, and that'll be something that we continue to pursue.
Yeah, I think with bringing all those township fire districts together, there's a real opportunity to make sure that we're consistent in that. And if there are, I would be very open to hearing what supports you need to make that data work. And just an observation that one of the areas that you're identifying as a gap in coverage, there is a rural fire district station within that space. So just more collaboration may help us sort of solve some of these problems. Maybe not to the scale that sometimes we think it's going to cost, or we think the resource is going to be there, but that's way down the road. I get that. But the more collaboration that we do, the more those kind of conversations can happen about creative solutions to make sure we're serving everybody across the county better.
Commissioner Kelly, I think that makes a lot of sense. I think that is something we can definitely look at, particularly with, you know, CFD1 having that station in that service area. That could be a potential help. I think part of the data problem is that when you have volunteers responding from alternate locations, you know, you just don't track that start time. So, you know, as long as we can, but I think we can get some data that'll get us close. And I think that might not make an accreditation report happy, but I think it would give, you know, elected officials a sense of additional data points in terms of how it's responding in those areas. Does that make sense, Tom?
Yes, it does. There are possibilities that exist in the CAD. We would just need to have a process of validating that data at the local department level. And then the data collection and having the administrative capacity to bring that all together would be the next challenge.
Okay.
I think I just have one more question. As briefly as you can you help break down kind of the tiers of calls or however you sort of categorize them? So you've talked in a couple of different moments in this presentation about, some incidents are major incidents and require multiple apparatuses and multiple personnel. Some are less emergent. A few weeks ago, I wasn't here, but I've listened to it after the fact. Some of the conversation around senior resources and needs and medical assist calls, a part of that conversation. Can you help give us I know it's broad strokes, but kind of an illustration of what those different levels of calls require or look like in terms of response? So, are there incidents that only an ambulance and an EMS is responding to without fire apparatus? And can you break that down just a little bit?
Yes, of course. So Interim Fire Chief Tom Fagan, we get asked this question quite a bit. Why do fire trucks respond to medical calls? And that's overarchingly across the county. And the real simple answer is to really provide the best quality of service to the community. Response times, as we talk about, are important, but not every medical call is an emergency. We're fortunate to rely on our partners, the Emergency Communications Center, which uses a quality practice system called ProQA to vet emergency medical calls as they come through the 911 system that essentially triages what are urgency level calls and what are non-emergency calls. For example, a generic sick call, I'm not feeling well. They'll ask a series of additional questions to essentially rule out a time critical emergency. And if they can get through those questions and essentially vet it to where it is not a time critical emergency, that would deploy, for example, an ambulance non-emergency to that incident. That would come out as a sick call. If through their questioning, they identify that there are possible signs and symptoms of a stroke, myocardial infarction, or another time critical diagnosis, that could include symptoms like chest pain, difficulty breathing, change of level of responsiveness. That would drive a differential response, which would identify a fire apparatus and an ambulance to respond as well. And they would both respond emergency. And the reason that we're sending more than just the ambulance in some of those instances is that the critical tasks that are needed specifically for somebody who may have a decreased level of consciousness, they may need to be carried down several stairs, flights of stairs. And so when we talk about critical tasks, that includes moving equipment, documenting what's happening on the incident, providing for scene safety, not only for the patient, but also for our responders as well. And so these are all the critical tasks that occur on more complicated incidents. On a basic level, that's the EMS side of it, but that expands all the way out to a cardiac arrest event. If you can imagine mitigating a cardiac arrest event, there are numerous activities that are happening simultaneously. And so we send a chief officer, we'll send an ambulance, and we'll send a fire apparatus to that incident to manage everything that's not only going on with the patient, but the scene, prepping the scene to move the patient, starting all of the advanced procedures, starting an IV, securing an advanced airway, doing electrocardiograms to diagnose what's going on with the patient. So there's a lot of activities that are happening, and all those critical tasks take resources to do. And so as the complexities of the incident compound, that compounds to more resources to complete those tasks in a timely manner. So I'll add one more complexity to that. So let's say like a motor vehicle accident with extrication. Extrication meaning somebody is trapped in the vehicle, they're injured, and they can't get out and somebody can't open up the door. So that adds additional critical tasks to the event, which would necessitate the resources to mitigate that, such as using powerful tools to manipulate the car in a way to where we can get the patient out without injuring them. The next step would be structure fires, all the way from, for example, maybe a dumpster fire to a commercial structure fire. The amount of critical tasks that are needed based on those risk profiles compound, which would necessitate more resources to respond.
Thank you. I appreciate that. Any other questions, commissioners? Okay. Well, we appreciate your presentation. We'll go ahead and open this up for public comment. Seeing no extra guests with us in the courthouse, I'll double check with staff about people online. Okay. No virtual hands raised, so we'll close public comment and bring this back for any further discussion. And this was an item that had no action. It's just for informational purposes only. So I'll open it up to other commissioners with any comments.
I don't really have any comments, just appreciate the update. And as always, your attention to data is very helpful for me in thinking about the best levels of service that we both can provide and what we can afford. So I appreciate that.
Yep. Thank you for the opportunity tonight. Have a good evening.
Thank you.
Thank you both again. I'll just echo and say that I really appreciate how detail oriented your data is. So I can tell that that's a big value within the department and appreciate the various ways in which you're looking at information. So thanks again for your time tonight. All right, with that, we will move on to appointments. Any appointments for commissioners to discuss?
So I am a little behind on our planning commission ones, but I actually have one who I think would be great. Prasanth Duver is a rural farmer in near the Lecompton area, has an interest in planning commission. I talked to a number of former planning commissioners who recommended him. And I visited with him. He understands the time commitment. I think he has some really solid values about rural land use. He also comes at it from a computer scientist background, which I appreciate the details that are necessary on this kind of very technical work. And always think it's important to elevate a voice of color in these spaces. And that's a goal of mine. And so I'm happy to recommend him. If others want more time, I can certainly get you some more information on that.
I would just say thank you for bringing that to us, and it sounds like a fantastic pick for the planning commission. So I would be in favor of moving forward.
Yeah, I really appreciate your time and diligence and talking with folks and really getting into the details of what planning commission appointment means. It's a pretty significant commitment. So excited about the person that you've identified and that they're on board. So
I'll make a motion to appoint Prasanth Duver to the Planning Commission, Lawrence Douglas County Planning Commission.
Second.
all those in favor? Aye.
Aye.
Great.
I have a few more coming to you. If you have people you want me to talk to, I'm glad to do that. I think Commissioner Reed communicated through Sarah that there may be another one. So we'll continue to work on that and bring those forward.
In the meantime, Commissioner, can you forward that contact info?
I will forward you that information.
Thank you.
Sarah, do you have any other appointments you'd like to highlight this
I
evening?
don't think I've got any to
Okay.
share at this point.
All right, well, we'll just move on to miscellaneous and let you kick it off with your memo.
Commissioners, my weekly memo is attached. There's some new dates added. There's a drug court graduation coming up. So I wanted to make sure you had that. In addition, included in background, and I think this will be helpful as you lead into budget. Jill prepared kind of an update on our Housing First pilot project. Commissioners will remember we received a grant from KDADS to do some Housing First work related to homelessness. This is really cool stuff and we're making some really great progress. So take a look at that and I think it'll help out as we approach budget. But other than that, commissioners, I don't have anything for you today.
Great, thanks, Sarah. I don't have any miscellaneous items to share. Commissioner Portillo? Commissioner Kelly.
I would just I was fortunate to attend the reentry simulation today done by Douglas County Sheriff's reentry program and Artists Helping the Homeless, which is an organization we work with on reentry, and would encourage members of the public to attend that. We had a nice turnout, probably about 15, 16 people. If commissioners have a chance or others have a chance, it's just a great way to see how our social service agencies are working together across the community, how that intersects with government, and the tremendous challenges that those coming out of incarceration have in our community. Luckily, in Douglas County, we have a lot of services there to help support that. But it's just eye-opening and a reality check and a really great activity.
Thanks for sharing that. I will add just a quick shout out to anybody who's with us in the public that tomorrow evening is our dedication of the Douglas County Treatment and Recovery Center. That's scheduled to start at 5:30 p.m. and the public is welcome to join us for that event. And it's an exciting milestone to get to. So I'm very much looking forward to it. And with that, I will say we're adjourned.